Alright, so I'm going to be performing my enema. I've looked at the diagnoses, I've looked at the orders, which the order confirmed for a large volume enema to be performed. I've looked at the frequency of those orders, I've looked at the notes, the allergies, and the procedure protocol. I've gathered my supplies, and I've performed hand hygiene. I walk into the patient's room, I introduce myself. Hi, my name's Sade. I will be taking care of you today. I'm a nursing student with HAC. Can I get your name and date of birth? Thank you, it matches. I have some questions for you today pertaining to an order that I have for you. Before I go ahead and do that, I'm gonna ask you about your allergies. I'm gonna provide privacy, make sure that the doors are closed and there's no one around. Lift your bed, get you all ready. So before I get started with the enema, I have a couple of questions about your bowel habits. When's the last time you went? What was the consistency? How often do you go? What's your diet like? And then I would perform a bowel assessment, and I got my gloves. Perform a bowel assessment. I'm gonna go ahead and remove this. I'm gonna auscultate in the lower right, move up to the upper right, move over to upper left, move down to the lower left. I did not hear bowel movements for 5 minutes in the lower left quadrant. I'm gonna go ahead and palpate the abdominal area, and there's some distension, so both the not hearing the bowel movements and the distension lets me know that the enema is appropriate. So I have my enema here attached here, a half to 3/4 of the way full with 500 milliliters of tap water. I have my line here ready to go. I've hypothetically applied lube 2 inches for this. I've put it off to the side. I'm taking my patient and I'm going to place them in the lateral position on their left side with their right leg up. I'm going to cover them up like this so they have some privacy. Okay, I'm going to unclamp the line here so that I can prime it, so I'm not putting air in my patient. And I'm going to clamp it again to not let the water out so that the patient gets all the water. I am inserting 2 to 4 inches. I'm not inserting 2 to 4 inches because I need my gloves. Put my gloves in. My hands. And before doing this, I would also perform perineal care. Wash up back here so that, you know, everything runs smoothly. Now I'm putting this 2 to 4 inches towards the umbilicus. I am raising this to increase sort of the speed. If the patient was to complain about discomfort or cramping, I would lower it to lower the speed. I would do this until all of the water was out, and then I would carefully remove, and I would put this off to the side, discard it. I'm gonna take my gloves off because I was just in this patient's back area. I'm gonna go ahead and I'll put the patient back on their back. Okay, Mr. Wolf, can you please hold that for a minimum of 15 to 20 minutes? I have a bedpan here for you, and I'm gonna lower your bed and put your call bell in reach when you need me. And that's it.